Nguyen with Happy Clinic Denver. We're gonna do a Facebook Live with CoolSculpt. So I'm sorry I've got my shirt off. I haven't been working out. It's our summer. I know I need a summer body. So anyways, we're gonna mark first, and we're gonna show you how CoolSculpt works today. So Michelle, my laser tech, she's gonna mark first the areas that we want to treat, and I want to do my lower abs today, as well as some of my flanks. So this is my second treatment. It's been about a month since my first, and I've already seen some really amazing results, and I'll post some before and after pictures soon. Okay? Let's go.
So we're going to start with your flanks off so we can find out first. So I'll show them how we mark it.
Can you just talk a little louder?
I'll try.
Okay.
So we're doing this side first. So
Okay.
we're going to do this side. Mark where the fat tapers.
So she's marking the flanks right now with the pen. And she's actually just kind of compressing my little pudgy, little fat pockets.
Fat pockets.
You may want,
I think we're going to go a little bit higher. Like here.
so it's kind of like mapping first what you want to kill. You know, every great thing has a roadmap to get to there, so we definitely want to mark and map first the areas we want to treat to make sure we get the most effective placement of where the CoolSculpting pad comes in.
So we're going to draw around where the applicator is going to go.
So she's drawing where the applicators are going.
Alright, and then we're going to do the front.
So we're going to do this part of the front so that we can dual sculpt at the same time, which is one CoolSculpting machine on my front abs on this side and one on my back on this side on my flanks. That way it's only 35 minutes per session, and I can do 2 areas at once. I kind of like this lighting. It's not making my body look too shabby. So she's kind of poking and feeling around, making sure that it's where we want it to be.
To mark the peak of where the fat is.
So we're marking the peak of where the fat is, and
we're marking where the fat starts tapering at.
okay.
We'll line that up.
A little more to the front.
Yeah, probably, yeah.
Yeah.
We want to get the center, we want to get it right on the center, maybe right in there. Yep. Perfect. Alright, looks good.
So
Look, we got some... Oh, somebody says, put on a mask to give yourself a fun look. Oh, that was actually Facebook. I don't know.
Okay, so...
So what we're doing now is we're kind of prepping the area.
So this is a protective wipe that just protects the area. We'll wipe it for a minute.
Do both at the same time.
You can do both. We can do both at the same
I can do the
time.
other one right after.
And I'll go ahead and keep on wiping for you while you do the other side. And obviously this is not painful at all right now.
That is to protect the skin.
So what this does is that it cleans the skin, but it also protects the skin from freezing, so that you know, it's safe for the procedure. I mean, obviously you want to protect the skin, but kill the fat cells at the same time. Okay, all right.
So now that you have done that, what is the next step?
We're going to apply the gel pad for the applicator.
So after this, we're going to apply what's called a gel pad. It looks like a paper towel that has a special chemical on it that, again, keeps the skin from freezing, but lets the cold through to actually freeze the fat underneath. And it's a little bit of a translucent gel pad. And it's not cold at all. The old technology, the old CoolSculpt gel pads were cold and it kind of stung you, but this is very room temperature. It goes on very nicely, not cold at all.
You want to turn around and I'll show them on the back?
Sure. Again, room temperature, fits very comfortably on the skin, nothing cold at all at this point.
Okay. So now we're going to start the
Yeah,
machine, activate
okay.
the cooling.
So what she's doing now is she's gonna suck that fat in. A little higher.
Stand up.
Stand up.
Stand up.
Straight up. Okay, good. All
There
right.
we go.
So it's like a vacuum cleaner. It's just, once it gets placed right on there, do you see that? It just sucks the fat into there. I mean, I don't feel any pain. It just feels like somebody's,
Can you hand me the bottle?
it feels like somebody's just grabbing on to that portion of my fat. So it doesn't feel painful at all. It just feels like a little suction area. So I'm going to hold on to this to keep the machine in place before I sit down.
Alright, so now we're going to take you to sit down.
Okay, so I'll sit down. Perfect.
Move back.
Lean back a little bit. Okay. And now she's going to place the other suction on.
Sit back.
Or sit back. Oh, sit back in the chair. Okay. All right, perfect.
How's that for comfort?
Yeah.
Can you sit back
Yeah.
enough?
That's fine. Very comfortable. You want to bring the camera over to this side so see maybe better? Kind of point it down just a little bit. Okay, perfect.
So we're going to put another pillow behind you, Doc, just to get you
Alright,
comfy.
she's getting a pillow ready for me.
Sorry. Alright.
So she's going to place the other gel pack on. Okay, thank you.
Okay, sit back, Tom. Alright, we'll activate the vacuum on this one.
And now it's going to vacuum it up. Right there. Yep, I just feel that fat sucking in.
button at the bottom on that one?
So we're gonna press the button to start the cooling on my right backside right now, my right flank. So I'm starting to feel a cold sensation. It kind of feels like, I don't know, not very cold at all right now. It's starting to feel a little colder. And it's feeling pretty cold, like close to somebody putting like an ice cube on my flanks. And now she's going to start the other cooling.
All right.
Now this side is starting to get cold. Kind of just feels like cold air blowing on it. Turn this way. Yeah. Well, and that's it. So I'm gonna stay in this position for the next 30-35 minutes, and then we'll come back for a Facebook Live in about 35 minutes to take these suction things off. But otherwise, you know, as a patient, you're gonna sit here, you're gonna play on your phone, you're gonna talk, you're gonna text, you're gonna do, you know, you can work, do whatever you want, and then the machines start beeping at 35 minutes to tell us that it's done, and then we take that off, and you can see what it looks like afterwards. It just feels cold right now. I feel like there's a couple of icicles on me. It's not painful. I would say on a scale of 1 to 10, it's a 1 or a 2 for me at the most. I know everybody has a different pain tolerance, but I guess I have a pretty high pain tolerance. But anyways, we'll be back in 30 minutes. Bye. Bye.